COVID-19 containment strategy involves a multi-pronged approach. Rapid and easy access to testing becomes critical, along with lockdowns and social distancing. To contain community spread, it is critical to have the testing infrastructure widely available for pre-symptomatic cases. Furthermore, it's important to make testing available at locations of the patient's choice without crowding and exposure at hospitals or diagnostic labs. The idea proposes register and manage drive-in facility for COVID-19 test, ability for patients to digitally book for drive-in slots, automated reporting to patients, reporting test results to the government agencies, coordination with approved testing laboratory. Let's see a demo of the mobile app. The first use case is an organization KMIT registering to provide its campus for drive-in testing. Once approved, KMIT user logs in, view and approve the drive-in testing requests. User is also able to edit available slots. Second use case, a registered user Sandeep is logging to book a testing slot. He chooses a location based on the proximity, selects a time and gets confirmation. Third use case, the used Keda who got tested yesterday is logging in to check the testing results. Testing appointment and results are shared with government agencies. The idea includes 3D printing of a swab, which is a critical component of COVID-19 testing kit. This is a video of 3D printed swabs that the team has indigenously printed at the KMIT campus, and a picture of a swab. To summarize the idea: set up and manage COVID-19 testing drive-in facility, mobile app for patients to book drive-in slots, 3D print the nasal swabs at KMIT campus. KMIT and NGIT's centrally located college campus available for COVID-19 drive-in testing.